Good morning, everyone. This is Dr. Buddy Donaldson, and today we're going to talk about the Rapid Palatal Expander, or RPE, and why I love to use it in my practice. The Palatal Expander is the best orthopedic appliance that I can use. It works by widening the upper arch, and the best time to use it, we think, is when baby teeth are still present. Our scientific studies have shown the best time to get widening of the upper arch is between the ages of 4 to 10. Now, I will tell you that I think 4 or 5-year-old is a little bit too early, because I think it may be asking too much of a 4 or 5-year-old to try to do a palatal expander. But I think that around the age of 7 or 8, when there's still some baby teeth present, that is actually the best time to use it. Now, one of the things I want to do is show you a picture of my daughters. Both of my daughters had palatal expansion. Their arches were a little bit narrow, so I used a palatal expander, and now both of them have beautiful smiles. So we think that the palatal expander was very important in trying to get a great smile for them. So what does a palatal expander look like? And this is it right here. And you'll see sometimes we'll attach it just to 2 teeth. But with this one, what we're doing is we're attaching a palatal expander to 4 teeth. So this is what the palatal expander in this particular situation is attached to 4 teeth. So if we take a look and we look at a regular arch, in this arch, this is the upper arch and the lower arch, there's enough room for the teeth. Obviously a palatal expander is not needed here. So if we take a look, the middle of the upper teeth meet the middle of the lower teeth. An upper tooth here, this between 2 lower teeth here, and that's what we want. But sometimes to get to there, it takes a palatal expander. Okay, so one of the first things that a palatal expander does, it widens your upper arch to make enough room for all the permanent teeth. What we don't want to see happen, and let's take a look at a model right here. What we don't want to see happen is an upper arch that is so narrow that there's not enough room for the permanent teeth to come in. And you can see in this particular situation where the eye teeth are coming way out here, this upper arch is very narrow, there's not enough room for the permanent teeth, and so this eye tooth has to come out here and it looks almost like a fang. And that's a look that we're trying to avoid. In this particular patient, the same thing happens. So you can see here there's a very narrow upper arch, not enough room for the permanent teeth to come in, and again a palatal expander would need to be used here. If we look at this patient, we use a palatal expander as well, because what happens is the lower jaw has developed forward of the bottom arch, and so what we do is we widen the upper arch of the palatal expander, and then we start bringing the top teeth forward so that we can get the top teeth to overlap the bottom teeth. And that's another reason for a palatal expander. Now, I'm going to show you a picture here, and if we'll take a look, this is before and after. Here's before, and there's after the palatal expander. Now, please note, this is the patient's nasal septum, and it's curved right here. And you can look here at the nasal airway, and you can see where it's blocked. Well, the palatal expander did a couple of things here. It helped align the nasal septum, and you can look here now and see that the nasal airway has open, and it will allow this patient to breathe better through the nose. I've had some patients that will come in, and here's another benefit, where they have a lot of sinus infections and a lot of headaches, and the palatal expander will help widen them. And I can never promise or guarantee this, but we've seen a lot of patients come in to where after we do the palatal expander, the sinus infections decrease and the headaches decrease. Now let's take a look at this screen. Now if we look at this patient needed what is called a surgical palatal expander. This patient was an adult. Now you're looking at an airway right here that's really good. So there was a surgical palatal expander and some jaw surgery that was done here to help with the airway. So this patient once had a CPAP machine, and now that CPAP machine is gone. Now let's take a look at this patient. Top teeth stick out a little bit too much. This airway right here is very narrow. This particular patient we did a palatal expander on, and they were having headaches since they were a child. We did a palatal expander on this person, and the headaches went away. So our patients and parents have said that there's been fewer headaches, fewer sinus infections. With the surgical palatal expander, some adults have stopped snoring as well. Children have stopped snoring as well also, because children will snore also, and the palatal expander helps with the airway where the children can stop snoring. And this is an airway problem that we are now starting to address. It's been with us forever, but if we widen the upper arch of the palatal expander, it helps with the airway. The palatal expander also decreases the chances of your eye teeth impacting. So a lot of people have narrow upper arches, and the eye tooth, or the third permanent tooth in the arch, will impact because there's not enough room for it to come in. And I guess the main reason why I like to use a palatal expander with all the other ones is, when I widen the upper arch, it helps my patients get a broad, beautiful smile. So, that's enough today for the palatal expander. If you have any questions, please give us a call.